one that we really think is important, that our friends at Concerned Veterans for America have been talking about as well, is essentially adopting what is called site-neutral payment for the VA's community care program. In a nutshell, what this means is same reimbursement for the same services. Because what actually happens right now is different places that you get the same service get reimbursed at different rates. So if you go to a doctor's office that is actually owned by a hospital, they charge a much higher rate for literally the exact same service that a local family-owned physician's office would be able to charge the federal government. So all we're saying is same pay for same service, whether it's at a hospital in an ER, whether it's at a local clinic, whether it's at an emergency care center. All of those places should receive the same reimbursement rate for the same services because they should cost the same.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential.
Welcome to the American Potential Podcast. I'm your host, David Fromm. Today's episode is another in our Big Ideas for Smaller Government series. And the idea is to talk about spending cuts that could be made to the federal government to reach our goal of cutting $2 trillion. And as we share our ideas with you, we want to hear your ideas. And you can submit those at dogeidea.com. That's DOGE idea.com. Today, we're going to focus on the Department of Veterans Affairs. Now, the history of the department dates all the way back to 1636, when the Pilgrims enacted a law ensuring the community would take care of disabled soldiers. Fast forward to 1776, and the Continental Congress decided to provide pensions for disabled soldiers, and some state and communities even provided medical care for them as well. In 1811, the first medical facility was set up for veterans by the federal government, and over the years, different federal agencies were set up to help veterans. But in 1930, President Hoover signed an executive order which created the Veterans Administration. And finally, in 1988, President Reagan signed a bill turning the Veterans Administration into the cabinet-level Department of Veterans Affairs. So now that we've talked about some of the department and how it got its start, we're going to walk through how much their budget is and what cuts could be made to save taxpayers' money with our guest, Jeremiah Mosteller, who is the Policy Director for Americans for Prosperity. Jeremiah, as always, welcome back.
It's so excited to be here, as always. Highlight of my week.
Excellent. Same here. Hey, so we're going to be talking about the Department of Veterans Affairs. I was just kind of curious, have you had any family members that have served or are currently serving in the military?
Yes, sir. So my grandfather served in the Navy, had an uncle who served in the Coast Guard, number of cousins that had been in the Marines and the Army. And I can tell you that I'm just thankful for every veteran out there who has served to keep this country the land of the free.
Yeah. Amen, brother. I totally agree. You and I have colleagues who work for Concerned Veterans for America, one of our sister organizations. We've had a number of them tell their stories here on this show. And I'm always so inspired at the sacrifice that a lot of them have engaged in and that their families have made. And just their service is so inspiring and their stories are so inspiring. And I'm so appreciative of what they've done for us. Well, hey, so to start off with, let's have you go over to the whiteboard, which we're bringing back. I'm very excited about it, and talk about how big the VA actually is.
Of course. You already said one of the things that I wanted to make sure listeners understood today, because I think most people assume that the Department of Veterans Affairs is a part of the Department of Defense. But as you noted, it is not. It is its own cabinet-level department. So it is not a subsidiary of the Department of Veterans Affairs. It is its own thing. And it has a budget of $405.8 billion, or 4% of the entire federal budget. And it's broken down roughly in two thirds. There is the National Cemetery Administration, which essentially manages hundreds of military cemeteries across the country. But worth noting, fun fact, Arlington Cemetery, probably the most well-known military cemetery, is not under the VA. It's actually under the Army, under the Department of Defense. So there's maybe some efficiencies there we could talk about later, but that was an interesting fun fact that I was sure your listeners didn't know. There's also the Veterans Benefits Administration, which manages disability benefits, healthcare benefits, life insurance, those types of things for veterans. And then last but not least, the one that most people are best aware of is the Veterans Health Administration, which is the component that manages the 1,250 different VA healthcare facilities across the country, as well as the Department of Veterans Affairs, essentially health insurance program called the Community Care Program. And so that's where a lot of the money goes, is to that particular component within the VA. But there's also 19 other offices as well, in addition to kind of these three main components that do everything from the Board of Veterans Appeals to the Office of General Counsel to their policy and regulatory work. And so it's a pretty big department. And again, it's not a part of the DoD. It is its own separate component. And so this spending is an additional to the budget of the Department of Defense, which hopefully we'll talk about at some point.
Yeah, no, that's news to me, especially the part about Arlington. That's really pretty fascinating. I think I'm gonna use that and make myself seem smart when I talk to my friends. That's next time I'm in Northern Virginia. Well, so hey, how has the VA budget changed over time? I mean, it seems like it could be related directly to the number of veterans.
Yeah. So, David, this is actually kind of something we didn't think about talking about for other agencies yet, but I think I learned a lot when talking to one of my colleagues who works at Concerned Veterans for America and our friends over there. And I did not realize that the VA's budget has went up 4 times between 2004 and 2024. So it has quadrupled in that time period.
Wow. That's incredible.
The number of veterans has declined by 30%.
Sure.
So,
I mean, I guess you have the greatest generation kind of passing away, and yeah, wow.
Yeah, and it's worth flagging that a lot of this growth did come during the Biden administration, where they hired 80,000 new VA employees within those 4 years. So they either backfilled a lot of roles or created a lot of new roles and bloat within the VA. And so I just want to make clear to listeners, we want to make sure veterans are taken care of. We want to make sure their health care is provided effectively. But it seems interesting that the budget is quadrupled when the number of veterans has declined by 30%.
Yeah, I think so many times we see budgets and bloat happening, and yet the core mission that we all would agree we want that agency to execute on sometimes gets lost. It isn't necessarily going to the core mission that we think we're paying for. So last year, our colleagues at Concerned Veterans for America shared a story that Fox News reported on, talking about the VA handling medical claims for the health care of unauthorized migrants. Were they ever able to find out how much that cost taxpayers?
Yeah, David, we're not sure of the exact cost, but I do want to make it clear to listeners, this program was not the VA providing health care through its facilities to these individuals. This was a different component, one of those 19 other offices, called the financial services component within the VA, that was essentially processing the claims for ICE. Now, the problem there is that this wouldn't necessarily be an issue. There's potentially some efficiencies at play in there, but the VA is not being able to serve its core customer, which is veterans. And what we know is through the community care program, our friends at the CVA have said that veterans are being stopped every step of the way at being able to receive the benefits that they deserve under the community care program. So that's a big concern, is that the VA is either not willing to or not able to provide these benefits effectively to their core customers. There was a lot of questions being raised about why those same employees and same resources were being leveraged to provide this processing for folks coming through ICE, which, as you said, are undocumented migrants.
Well, I mean, do you think the VA has ever explained why community care can be provided to unauthorized migrants, but not the veterans that they're supposed to be serving?
They have not, and I think it's candidly because they don't want to have to answer that question. We know that through some leaks and through some revelations during the Biden administration, top VA brass essentially told all of their employees to try and prevent every single veteran from using community care and to force them to drive hours or to wait months for care at VA facilities. And so there's actually this active campaign to prevent people from using that program.
And Jeremiah, what's behind that? Why in the world would someone do that to people who served our country?
Yeah, I mean, it's super confusing, David, because the reality is that the VA can't be the best provider for every single veteran out there. Maybe they want to go to their local doctor because they have a relationship, or maybe they can't get the special care that they want until a year from now through the VA directly. And so, but they have a provider right there next door to where they live that they can go to. I mean, I think ultimately it goes down to something you talked about earlier. It's incentives. The VA wants to be able to grow their budget, and having high cost facilities that they run directly themselves means they can ask for a larger budget from Congress rather than processing claims from community care.
So turning kind of to more spending, which also seems out of line with the core mission of the VA, which I think all of us can agree is a worthy mission. One thing that was discovered recently was that the VA was paying a salary survey company $3.9 million a year. So first, what does the salary survey company do? And then why are they getting almost $4 million a year?
Yeah, David. So my team, we spent a long time digging through 3 to 4 different federal databases to figure out, like, hey, who is this money actually going to? What was it paying for? Because the details were not very clear, and you have to dig really, really deep into like the details of the actual contracts to figure this out. So what we discovered, kind of beyond what the news was reporting, is that this money was going to a consultant company called Deloitte Consulting. Most people will probably be familiar with that name. Generally, they probably heard about it in the news before. This is one of the largest consulting companies, especially here in DC, but internationally as well. And they have received $27 billion from the federal government since 2018. And so for this particular contract, what it appears, based on everything in the contract they were being asked to do, was to survey all of the salaries at VA healthcare facilities, figure out what they were paying in the VA, then do a similar survey in the private sector, compare those two numbers, and essentially tell the VA whether they were paying their employees enough. Now, what's interesting is $2.3 million of that contract was flowing into the Deloitte and then going out to other companies to actually complete the work. So it's a little unclear exactly what Deloitte was doing, especially at that high level cost. And so I think there's a lot of questions about what was going on there. But I think, it will be really easy for the VA to do this at a much lower cost. Literally just survey your employees and ask them what their salaries are, and then go to your competitor and say, hey, what are you paying your people? And compare the numbers. It's not that hard. You don't need to spend nearly $4 million to answer that question.
Well, I'd imagine that the information as to everybody's salary is kind of contained within the agency or one of the agencies. It's kind of funny you need an outside consultant to come in and get $4 million in order to go figure out what data you have. So my understanding was the VA ended up switching companies. So what's the new cost to the VA, and what is the average cost in general for that service?
So the new cost is around $5,000, and the VA reports that that is the market rate that something like that would ordinarily cost. We don't know who's doing it, whether it's an internal thing or an external thing, but we know that they were able to identify a way to do it for $5,000 a year. And so that's a much lower cost than the more than $3 million that were going to Deloitte.
I mean, that's just infuriating as a taxpayer. I mean, seriously, you have VA, you have veterans being denied health care, being made to wait in line, driving forever. And yet we're spending $4 million on something that now we could do for $5,000. It's just maddening. And the reason that DOGE and this cost cutting has to happen. Well, besides the salary survey, what are some of the other ideas that you and your team have to help cut the costs at the VA?
Yeah, David. So one that we really think is important, that our friends at Concerned Veterans for America have been talking about as well, is essentially adopting what is called site-neutral payment for the VA's community care program. In a nutshell, what this means is same reimbursement for the same services. Because what actually happens right now is different places that you get the same service get reimbursed at different rates. So if you go to a doctor's office that is actually owned by a hospital, they charge a much higher rate for literally the exact same service that a local family-owned physician's office would be able to charge the federal government. So all we're saying is same pay for same service, whether it's at a hospital in an ER, whether it's at a local clinic, whether it's at an emergency care center. All of those places should receive the same reimbursement rate for the same services because they should cost the same. I mean, if you're getting a flu vaccine, it should cost the same in a doctor's office as it does in a hospital. And so let's provide that same reimbursement rate across those different facilities. And so, interestingly enough, actually, Representative Rick McCormick out of Georgia has introduced legislation to do this very thing. And so it's exciting to see that catching some fire. And I think the last thing I'll tell your listeners about this is the same thing Medicare does. They provide different reimbursement rates based on the different places that you receive services, not the different types of services you receive. So there's also a conversation about larger medical reforms as well, beyond just within the VA.
You know, we had Congressman McCormick on just a few weeks ago, and he talked in depth about this idea. And it was just really cool because he's such a cool mix of experience being a veteran and, you know, a combat veteran and an ER doctor. So just his perspective is pretty fascinating, and we really enjoyed talking to him. We're gonna talk to him again because I think hopefully our listeners liked him. So how is the payment system set up now for the community care network?
Like I said, veterans can go in, they can request to be able to go to a community care facility, but then based on where they go, like I said, there is different reimbursement rates to those facilities. Yeah. And so right now it's just the hospitals can code a different thing on the back end than your local doctor's office can do. And so what we're saying is, hey, it should just be the same code for the same service and the same reimbursement rate.
How much do we think could be saved if we had a site neutral approach?
Yeah. So it would save around $14 billion just for the VA to do this with their community care systems. That's a lot of money. And that brings our total up for the entire series, David, up to $1 trillion, $117.5 billion. So that's adding a lot of additional savings to already the savings that we've identified so far in this series.
Yeah, that's we're starting to get there. That's encouraging. Can I just ask you again about the site neutral idea? What's the resistance to that?
I mean, the resistance is hospitals. Hospital systems want to be able to continue to be reimbursed at higher rates. And that's why you've actually seen, and folks probably have noticed in their communities, more and more of their doctor's offices converting from being local, family run, kind of, you know, you have the son and the dad that were both doctors and they run the clinic. That's why increasingly you're seeing either them shut down and become part of the hospital system, or the hospital system actually going in and purchasing those doctor's offices. Because even though literally there's no difference between the family doctor's office and the one owned by the hospital, they can charge higher rates merely because a hospital owns them now.
Yeah, so I've been aware of that dynamic, you know, in the larger healthcare system, and it's just something certainly doesn't seem right about that. Well, I'm glad that we're well past now the 1 trillion mark of cuts that we really hope that you and your team have laid out. But what if someone listening has an idea for some cuts or even regulations that need to be cut? Where's the best place for them to share their ideas with us?
Yeah, David, dogeidea.com, DOGE idea.com. We believe the best ideas come from the ground up. And so we want to hear from folks across the country about what they think should change within the federal government.
That's great. Well, I'm looking forward to our additional conversations on other agencies, because there's still a lot of cuts to be made to get us to the 2 million. Unfortunately, there's a lot of wasteful spending for us to highlight.
For sure, David. Well, I'm looking forward to continuing the conversation.
Yeah. Thanks, Jeremiah, for coming on again to talk about how the government can save some money and, you know, really do a better job of taking care of folks who served our country, who we really have an obligation to give good service and certainly good health care to. Well, hey, folks, if you like this episode and would like to stay connected with the podcast, be sure to like and subscribe to our channel, as well as following us on Facebook, Instagram, and YouTube. Always remember, liberty and freedom are easily taken for granted. Don't take it for granted. Go out there and defend freedom and liberty. Thanks for joining us, and we'll see you on the next episode.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.